In 1964, the Kidney Foundation of Canada was established in Montreal, Quebec, with a single purpose: to improve the health and quality of life of people living with kidney disease. This is our story.
When I was 15, I started to feel a little sick. Nothing serious, but I just didn't feel well. And my doctor did a series of tests. Couldn't find out what was wrong. I had just a little bit of pain and nausea. And they found out very quickly that I had very little kidney function. And at that time, there was no dialysis, no transplantation. So they said to me, to my parents actually, if we can't save part of her kidneys, she will die.
Chronic kidney disease is a condition where the kidney is no longer able to filter and the level of poisons rises in the blood. And it's a serious condition because the kidney is important in getting rid of toxins and making certain hormones. And if they're not working, then a lot of the body actually is affected by it. It's an important condition in Canada because many people have it and don't know they have it. And the symptoms are quite silent, and so it accumulates over time. And it's estimated about 1.9 million people in Canada actually have chronic kidney disease.
The 1960s were a time of enormous change in society, but also in healthcare. It became possible to see a solution to diseases which had previously been 100% fatal in a very short term. There was nothing more lethal, for example, than kidney failure.
When a 26-year-old Montrealer died within months of being diagnosed with kidney disease, his family, friends, and caregivers decided to do something about it. Their stories about what you can do when you have a compelling cause, a clear vision, and a team of people willing to make a strong personal commitment. Believe in your own success and you will succeed. Just ask Kidney Foundation of Canada co-founders Dr. John Dossiter and Harold Ashenmill.
There was no such thing as a nephrologist. Kidney people were not looked upon as being anything. And what put it all on the map was the dialysis. The concept of trying to keep someone who was in chronic kidney failure alive indefinitely, that was a new concept up until 1963. You only have to see how someone can be restored to health by dialysis to make a convincing case for it. But it is a very expensive. It still costs $35,000 a year to keep one person alive.
The initial meeting of the so-called Kidney Foundation, although at that time we talked about the Kidney Disease Foundation, was in Dr. Dossiter's office in the Royal Victoria Hospital.
This small group of people in Montreal then spread across the country in a movement called the Kidney Foundation, which put these issues on the national agenda. It's an enormous success story.
Then there was the field of transplantation, which was also opening up at the same time.
The society in general, unless they were touched, was not quite aware.
To raise awareness, the Kidney Foundation focused its efforts on 4 key areas: funding kidney research and related clinical education, providing patient services, promoting organ and tissue donation, and advocating for access to high-quality health care.
The 3 areas of the mission, which are research, patient services, and organ donation, as well as advocacy. All 3 of those I have benefited from personally.
There was a need to raise money to support research because there were now issues that suddenly the physicians felt could be studied and answers could be found if there was enough research done.
If you go back 30 years ago, we were really only beginning to understand how the kidney worked. What happens when the kidney doesn't work? What things you can do to prevent those bad things happening when the kidney doesn't work. And that's evolved from basic science.
And of course there was great hope at that time that there would be some way to save people's lives.
The surgical procedure for transplanting a kidney had sort of been perfected, or it could be done. The problem was the rejection.
In 1987, Marcia Bell received a kidney transplant. Thanks to the many advances funded in part by the Kidney Foundation, the operation was a success.
And the reason I have had my kidney for 16 years is the fact that they developed some new anti-rejection drugs. Prior to that time, it was very rare for people to have a kidney that long.
The Kidney Foundation has played a role in all the new immune suppressive drugs, which have changed the outlooks for transplant recipients, not just kidney transplants, but others.
I think the Kidney Foundation has been very active in supporting research that has been ongoing, in encouraging people to generate new ideas.
Generating new ideas, advancing new techniques, pioneering new treatments. It's astonishing how many young researchers who got their start with the Kidney Foundation are now recognized as world leaders in renal research and treatment.
All this development about genetic diseases, and in particular nephrogenic diabetes insipidus, would not have been possible without the help of the Kidney Foundation.
I am such a believer in the importance of research because it saved my life. It really did.
No research, so no everyday, up-to-date treatment of renal patients. Impossible.
One of the important things that came out of all this was the relationship between kidney and hypertension. Hypertension damages kidneys. Kidney disease causes high blood pressure. So one of the early tasks that the Kidney Foundation carried out was going in the shopping malls and giving people, taking your blood pressure for free, and here's a pamphlet.
So the Kidney Foundation, we printed a lot of brochures on public information, and we circulated them in many public places.
What really helped so many patients, and certainly helped me, was to get the Kidney Foundation manual. It's a binder that talks about various causes of kidney disease and the treatments and the things you can do to manage your disease and so on. And it's a wealth of information, and I had that with me all the time.
Education is really the key to giving people a greater sense of control over what's happening to them. And for most people, that's important, to be able to, again, feel a greater sense of self-esteem, being able to maximize their own potential, feeling like they're contributing something. I think in addition to the educational part has also been the advocacy part.
At the branch level, we would look at how we can coordinate the delivery of Kidney Foundation programs across the provinces, and also ensure that what we do as a Kidney Foundation meets the needs of that population. At the national level of the organization, we do policy development and we develop new programs.
The Kidney Foundation has always been there as well, rooting for the cause, and it often needed support. It then became something which was depending on its volunteers so much to spread the news, educate the public, keep the doctors informed about what they should be knowing about kidney disease.
By getting thousands or tens of thousands of people across the country involved, we were in fact accomplishing a lot more than merely raising money. We were involved in public education among these volunteers, and they would pass the word on and so on.
My other great love is working with volunteers, and we have so many volunteers in the foundation. We have over 90,000 people who volunteer their time for the Kidney Foundation. Some go door to door for our March campaign. Some work with patients in terms of peer support, help with patient social activities, hospital visitations. We have people who have been instrumental in working on organ donation initiatives, because we have been a leader in organ donation. Most of our volunteers are involved in fundraising in some way.
When the public gives to a charity, they really want their agenda pushed forward, which is better health care at the end of the day. And the Kidney Foundation delivers very large amounts in relationship to the money spent. So I think the Kidney Foundation's programs are effective, and its track record is a very strong argument in favor of people providing money for it.
There have been tremendous advances, not enough, but there have been tremendous advances so that even if you are afflicted, your quality of life is a lot better.
And I hope it will continue to flourish indefinitely, because I don't believe we've solved the problem of what causes kidney disease.
It's come a long way, but maybe not far enough.
If you would like to know more about the Kidney Foundation of Canada or how you can help, contact us at 1-800-361-7494 or visit our website www.kidney.ca. This video has been made possible in part through funding from Hoffmann-La Roche Limited. The Kidney Foundation would like to thank everyone who helped make this video possible.